Good afternoon, everybody, and welcome, and thank you for being here. My name is Maria Pia Amato. I am neurologist in Florence University in Italy, and I am the president of the ECTRIMS. So, of course, we are very excited to have this huge congress tomorrow. That is going to be a hybrid meeting. So we are really eager because after 2 years of the pandemic, we are able to meet once more in person. At the same time, we are maximizing also virtual participation for this hybrid meeting. And for the moment, the figures are this, that this year we have more than 8,000 participants from 109 countries in the world, more than 20 speakers that represent, of course, top experts in the world on MS and related disorders. We also have young speakers. We have specific sessions dedicated to young investigators that, of course, are very important for the ECTRIMS that has also a huge educational mission. So I would like to introduce my colleagues. So Professor Bernard Houtehach, that is the local chair and the co-chair for the Scientific Congress Committee, together with Professor Martin Toré, that is currently the vice president of the ECTRIMS, but she is becoming the new president in a couple of days, actually. And lastly, Professor Tobias Derfus, who is currently Secretary General of the ECTRIMS. So we are very happy to try to answer every questions you may raise. Please. And you have to go to speak to the microphone as we are recording this session, this meeting. So if you want to ask a question, please go over there and ask the question using the microphone.
Hello, I'm Kathy Carlson from the National MS Society. I was hoping that you would give us a little overview of what the most exciting things we're going to see over the next few days. Some controversies, some like what's new that hasn't been reported yet. I know that's a big question, but I think that was what was promised in the our summary.
So it seems to be a simple question, but it's a very difficult one because the Congress is so rich. We have identified 4 main tracks for the pathogenesis, treatment, clinical track, and the biomarkers, imaging and non-imaging biomarkers. And if you want, my colleagues can expand on the different topics. But we expect to have really cutting-edge results from the research on every of these main topics. And so, Bernard, who is the co-chair, if you want to.
Well, it is, of course, a challenging question because it's such a large one. And when you notice something, you may forget something else. I think we will hear new things about the first event in MS, which is crucial, I think, for finding a proper treatment on the right time. We will find new information on the diagnostic process, whether or not to include the optic nerve or the visual system, which is also crucial. I think we will hear about new treatments and earlier treatments or more aggressive treatments, and we will hear about lifestyle intervention, which is also a very hot topic, I think, in many people with MS. And that's just to highlight some, and and not to diminish the others.
Yeah. If I may also raise, there is also an important lecture, which is going to be the presidential lecture on MS in children, because we also want to highlight the importance of this disease that is usually very active and very aggressive when it turns to children. So there's going to be a very nice talk on children in MS in children, and also other topics such as pregnancy, breastfeeding, etc., are going to be very specifically targeted, and there are hot topics and challenges related to these also important things for our patients.
So maybe regarding the early events in MS, I think this is like a topic during the last years that it was seen that even before patients are diagnosed, they have a higher use of the healthcare system. So it seems that they had symptoms before they were diagnosed, and you might have seen a very recent publication on this EBV infection, that this was before onset of MS and also before the biomarker, one of the big biomarkers, neurofilament, goes up. So certainly these environmental factors like virus infections, especially EBV, and the biomarkers are a topic of this meeting. But in addition, also these early events are, of course, interesting, that we understand that the diagnosis is not the first step of the disease, though there's a lot of prodromal disease. And in clinics, we often see these patients that come with other symptoms like migraine. They get an MRI and they have a new lesion in the brain that's called the radiologically isolated syndrome. And at this meeting, there will be, I think it's the first clinical trial that looks at treating these patients. That is always the question. If you see the patient, should the patient be treated, and will the patient benefit from this treatment? And now the reports of the first study, I think many more will come. But we will have the first study presented here in the late breaking section.
News. Yeah.
And also, progressive MS continues to attract a great deal of attention, and we have this relatively new concept of PIRA. PIRA is an acronym for Progression Independent of Relapse Activity. So there are many new evidence that, in fact, progression starts very early during the disease course, and possibly at the very beginning, when the subject is at the clinically isolated syndrome stage. So at the first clinical symptom, you can already see progression ongoing, disability worsening, apparently dissociated from relapses or MRI activity. And this changes the perspective to look at the disease, because we are aware that we should start from the very beginning treating these patients, trying to delay the onset of the secondary progressive phase, and we should probably combine currently available immunosuppressive or immunomodulatory drugs with potentially new neuroprotective or neuroregenerative strategies that are in less advanced phases of research and experimentation.
And also, we are going to see the importance of registries and of real-world data collected across centers, because this is nowadays many times the only way to compare, for example, between treatments, and to have data that appear in the long term, and therefore clinical trials are not there for so long. So we need to collect data over time, and registries are doing a fabulous are bringing us a fabulous information, and we are going to see presentations comparing different approaches, comparing treatments with higher efficacy, with moderate efficacy, also comparing different high efficacy treatments among them, And so I think, yeah, lots of very important information for our clinical practice that is also brought from these registries that are so important nowadays.
And if may add to what Mar said, the comparative data are extremely important, of course, because we have approximately 20 therapies with different mechanism of actions, safety profiles, and power, but we don't have trials comparing directly these agents. So registries are important, and during the Congress we will also listen the results of comparison between the powerful drugs such as the monoclonals and the hematopoietic blood stem cell transplantation, that is bone marrow transplantation in MS patients, that seems to be the most powerful instrument. And there are very important studies comparing bone marrow transplantation with these highly active agents, and these are going to be very telling to us.
Also, we are going to see results of a trial on vitamin D in CIS patients, which I think is also going to be very informative. This is a question that our patients ask us. Do I have to take it, and what is the benefit of taking vitamin D? So this is also an important result that we are going to see.
Yeah, and another hot topic is you heard we have very effective therapies, but they also have side effects, and there are often discussions with the patients when to stop and if to stop the treatment. So especially in the depleting therapies like the B-cell depletion, how long should you go on depleting the B-cells in the patients? And is there maybe a point when the immune system is changed so much that even if you stop the treatment, the patient is still in remission? And this will be discussed in Hot Topic 2 about NMO and MOC-associated disease, but of course it's relevant also in multiple sclerosis in patients that are on these depleting therapies. How long, and what are the risks and benefits if you treat patients longer, and what are the factors that help you to decide if a treatment can be stopped safely?
Another very novel, important session is that looking at aging with MS. So elderly people with MS, because fortunately the life expectancy of our patients is becoming longer and longer. So the peak age is moving from the peak prevalence age from 40 years in the past to 60 years. So our population is becoming elderly, and this, of course, poses a lot of challenges in terms of therapeutic strategies, because these people, of course, have comorbidities, are more vulnerable to infections, even to tumors. And of course, we have immunosuppressive therapies that may be particularly risky in this population. And we need to get more information on the safety and efficacy of this treatment in this population, because these elderly people are typically excluded from clinical trials. So we have to look again at registry data or to think about new trials targeting this population.
Also, more and more on lifestyle. We are going to have data on diet, for example, which is something that our patients very frequently ask us, and there were very little answers because not very powerful studies on diet, and I think we are going to see nice results on this also, and also the importance of exercising, of quitting smoking, all these lifestyle interventions that are important, because these are the things that we as people can change, no? And we can change our attitude to this disease, and And this is also having more and more importance when we are dealing with this more, let's say, global approach to the disease.
I also think that biomarkers will be addressed in more extensive way. I think that may be helpful in clinical practice. We already know, of course, from the MRI scan how to incorporate that in clinical decision making. But now we may approach also biomarkers, especially neurofilament, to affect clinical decision making, and that it could be very helpful and a good way to have an indication about the activity of the disease even before the clinical symptoms occur, and might influence the decision on whether or not to continue or to switch from therapy, for instance.
And another topic that is going to be extensively treated is the safety of drugs during pregnancy and lactation, because of course this is a hot topic, not only because our patients are mainly women, but because we tend to treat the patients very early and to treat with highly effective drugs. There are women with highly active disease, and so it's important to use powerful drugs, and we will have some presentation regarding the safety of anti-CD20 monoclonal antibodies in pregnancy and in lactation. So we will hear, it's very interesting because these drugs are very attractive in pregnancy because they don't pass the placental barrier during the first trimester, so it's unlikely they are teratogenic. They have a long-lasting effect, and then we don't see any rebound phenomenon after stopping this drug. So the rebound is a reactivation, a serious reactivation of the disease that we can observe with other powerful drugs such as natalizumab or fingolimod. So the anti-CD20s category of monoclonal antibodies that seems to be particularly interesting for patients desiring a pregnancy.
And also more and more monoclonal antibodies seems to be compatible with breastfeeding, which is also important because we know now the advantages of breastfeeding, both for the newborn and for the mother, and the long-term beneficial effects of breastfeeding. And for many years, the counsel was not to breastfeed, but now things are changing, and this is also an important message for our patients.
I think, of course, we realize that we are living in a kind of privileged part of the world. So access to care is not the same in all areas in the world, and the specific scientific session 15 will address the issue of global health and healthcare access around the globe. I think that is also important for such a large conference to address.
And also we are very happy to have organized this year a summary of the highlights of the Congress on Saturday to be delivered directly to patients and to patients' associations. And this event will also be translated to the 6 more, let's say, global languages, simultaneous translation. So we hope many patients could be connected, and there are going to be 4 presenters that are going to try to summarize the most important things for the patients, and also we are going to have the possibility to listen to 2 testimonies of patients that are also going to contribute with their testimonies. So we feel that this is important, and ECTRIMS is really committed to deliver firsthand to our patients the novelties of what is going on.
Lastly, I would like to remind you that as every third year, the Congress is held in collaboration with the RIMS, Rehabilitation in Multiple Sclerosis, and hosts the 27th Annual RIMS Conference. So we are going to hear also not only the advantages that are clear of rehabilitation, but the new rehabilitation strategies, also using new electronic technologies, robotics, and so on. Are there any other questions or comments from your side? If not, I would like to thank, oh no, there is one.
Thank you for all that information. I'm Brett Drummond from MS Translate. Particularly interested in the Saturday session, and fantastic to hear that there's been a push towards communicating directly to patients. Obviously, I have a personal interest in that through what I do at MS Translate, but can you talk us through the decision-making process for that? Was that a push from patients? Was it a push within the committee? Just want to hear a little bit more about that, because I think it's a fantastic initiative.
I think we were all aware that this was something that was needed, and this was an initiative of the EXCOM, but of course this was also something that we have been listening during the past years, and we were absolutely convinced that we had to bring it close, so immediately after the meeting, and we wanted to do it firsthand. So it was discussed when was the best moment, and we thought that just after, the day after, it was the better moment to deliver this. And we have been discussing on how to bring it to more audience. We have also contemplated the possibility of using artificial intelligence to be able to deliver it to even more languages. But for the first year, we're going to stay with the 6 more official languages and with the classical translation, simultaneous translation. But yeah, we are convinced that this is very much needed. We also would like to ask you to help us to spread the word, because we are not so sure if we have reached so many patients. And this is important for us, that there will be a link where they could just put a very simple way of entering, and then there will be the possibility of different simultaneous translations. So we are very excited about seeing how this really reaches our patients.
Welcome. Welcome. Do you have any other questions, comments? If not, I would like to thank you again very much for joining us this meeting. And if some other question arises, you can contact our press team. They will be happy to reach out to you and help you. So thank you again. Enjoy the Congress.
Everyone as well, that a recording is going to be sent in a little bit.